Welcome back to our Ask the Vet Live from here at Companion Animal Vets in Dapto. My name's Melissa, I'm one of the vets here. And today we're talking about urinalysis, hence the gloves. And so I'm going to talk about what we look at when we get a urine sample. So this is for dogs, for cats. It depends on when you bring it in. So sometimes we send home the beads that you can use to collect urine samples with cats, and Matt's put a video on our Facebook page, is that right? On our Facebook and on our website about how to collect urine samples from cats, so using our special beads that you can pick up. With dogs we get you to collect with a saucer or something, a clean product that you can get, a container that you can get underneath either a female dog or underneath a male dog. Collect a sample and then put it into an airtight plastic container. A lot of people use clean takeaway containers and those sorts of things, generally things that you're going to throw out anyway. And then we do a urinalysis when you bring it in for us. We like you to bring in urine samples as freshly as possible. The things we're looking for can sometimes change over time, so if you keep the urinalysis for the urine for 24 hours, it can actually change what we can do with it. So really good idea to bring it in as fresh as possible. If you can't bring it in straight away, then putting it in the fridge in an airtight container for a couple of hours is okay. So what happens when we get a wee? Well, I happen to have one we prepared earlier, a urine sample. This is actually an actual urine sample, so this will have some interesting things in it because it's actually from a diabetic dog. So I'll show you the results, but so it will have some interesting changes, but I'm going to go through the process of what we do when we check a urine sample. A lot of our nurses do this as well. So this is our sample here collected. It's a free catch, so it means that the animal has just been out, done a wee, and it's been collected. We sometimes also take samples by what we call a cystocentesis, and that means we actually use a needle and we put it through the abdominal wall straight into the bladder and we suck out urine. Sometimes we do that because when we want to do a sample that we're sending away to grow the culture, we do that to get as a sterile sample as possible. Sometimes we do that because we have cats who just won't use a litter tray and we can't collect a urine sample, and that's not that uncommon. And we do it for some other reasons as well, like in dogs that are having trouble peeing because they've got stones blocking their urethra, then we need to get a sample with a cystocentesis. So this is a free catch sample though. So first thing we do is I'll just get a sample of it. So the first thing I'm going to do with this is use this little device here, and this is how we get a concentration. So we're actually getting what we call a urine specific gravity. So what I do is just put a little drop on the top here. Then we use light to refract in here. It's called a refractometer. And then I can't make sure that it's in focus. And now I know what her USG is, which is a urine specific gravity. The urine specific gravity we look at because that tells us how the kidneys are functioning. So one of the functions of the kidneys is to concentrate or dilute your urine. Depending on how much water you're drinking or whether you've got a condition that's making you wee more often, it'll change the urine concentration. And there's no right or wrong here. The information just gives us one part of the whole picture. Her urine is quite diluted, which is not unexpected in a diabetic dog that's drinking a lot. So they pee a lot of urine because they're getting rid of their glucose out of their body. So this one is quite low. It's 1012 or 1013, and so I will use that and I'll put that into the computer so we keep track of it. So that's our first step to get a urine specific gravity. Our second step,
do I want to view or want to give all
is to use one of these dipsticks, and you've probably all seen them at your doctor's surgeries.
Yeah, that's fine.
And it goes on these little pieces of filter paper or what that have little reactive substances on them, and we can actually read off those and find out some details about that urine. So in her, as I said, I would expect some glucose and possibly some ketones because she is a diabetic at the moment. And we already know her specific gravity is quite low. So what we're also looking for with this little case is to make sure she doesn't have a urinary tract infection, which are quite common in diabetics. And by getting a urinary tract infection, we'll often see that their urine is alkaline in a dog and that there is some blood or some blood product there. So that's what we're looking for. So once we've got this, using my other hand, I've put her system into the computer, and this is how we keep track of our urine samples. So it's a free catch. It was nice pale yellow. It was clear. The specific gravity was 1013. Her pH is actually quite acidic. No, none of it, not all of it's normal. So there's no blood, no bilirubin, no urine. She has some ketones, so we're going to say yes to that. Her glucose is actually, she does have some glucose, 2+. She has no protein. Okay, and we'll save that. So by putting it into our system like that, I'm just going to put this in the bin. By putting her results into our computer system, it then gets attached to her file, and we can keep track of trends and things that are changing in her urine. So that's how we do that. The other step we can do is, we don't need it for this particular case, but I'll also show you how we do it, is particularly for dogs, but sometimes in cats when we get recurrent. So there, that means something that happens a lot, something that happens often. That if we get lots of urinary tract problems, and so we've got signs of quite severe urinary tract disease, is that we want to look at the sediment in the urine. So sometimes we want to look for bacteria, sometimes we want to look for crystals. They can get crystal problems. So we want to look at the sediment. Sometimes we're also looking for kidney disease. We look for things called casts, which are an indication of a kidney problem. So we want to look at a sediment exam. And so I won't go through the whole exam. It'll take too long. But what we do is get some more urine. And put it into one of these little devices here, one of these little containers, and we actually put it into our centrifuge, which we balance.
You guys out the front the whole day?
And then put it onto urine, and that spins. And what that does is it spins those little containers out so that they're sitting sideways, and all the heavy stuff, so anything that's heavy, spins to the outside of the tube. So it spins down to the very little bottom, into that bottom section of the tube, like it does when you're at Luna Park and you're being stuck to the walls in the spinning rides. And then what we can do is take that sample out. We empty off all the rest of the urine, and we take the sample out of the very concentrated bit of the sediment down the bottom. We put it on a slide and we have a look at it under the microscope. And then we can see crystals, we can see bacteria, we can see casts. We can see anything that we're looking for that are solid pieces of material in the urine. So that's our steps for our urinalysis. There are some other chemical processes that we can do. These are our biochemistry machine here. We actually can look at protein levels in the urine by doing a specific test on the urine through this machine as well. That's when we're worried about kidney disease, and we're looking at grading kidney disease, particularly in cats but also in dogs. And we can do a urine creatinine ratio through our biochemistry machines as well. So our urinalysis has quite a lot of information. There's quite a lot of info we can get from We. So if you're if you're concerned about your animal, if they're urinating a lot, if they're doing squats all over the place, not particularly for the undesexed male dogs, obviously they pee on lots of things anyway, but if something changes, so if you've noticed a change in your animal's urination habits or in their drinking habits, so if they've started to drink a lot more, or they're asking to go outside more, not making it through the night, anything like that that might be an indication of urine or kidneys or bladder or some other conditions like diabetes, then it's very, very important to bring in a urine sample. If you're coming in for your first consult about the problem, if you can bring the wee with you, it makes a whole step disappear. You don't have to go home and collect a wee sample. If you want to ever collect a little pot to come to collect the urine sample at home, that is fine. You don't actually have to hold this underneath your animal, obviously. Collect it with something else and we'll give you a syringe to squirt it into the container. Hope that's been helpful, hope it's been interesting. If you have any questions, don't hesitate to send us a message. And if you have anything that you want to include in these videos, just let me know. Thanks, see ya.